Yeah, so I think one class of drugs that we've seen a lot of success with recently are the bispecific antibodies. And so this is something that is being investigated as well in mantle cell lymphoma. And so I'm very excited to see more results. We saw some with Glofitamab, I think, that looked promising. And so I think these drugs are going to be very promising, especially for the high-risk population. We don't really have any data that I'm aware of right now on the efficacy of these in the high-risk TP53-mutated population. I think the other trial in the relapse setting that will be interesting is looking at Pirtobrutinib, so the non-covalent BTK inhibitor. In CLL, we know that resistance to BTK inhibitors often happens through mutations in BTK, whereas in mantle cell lymphoma, the mechanism of resistance is much more complex. And so where Pirtobrutinib has a clear role in patients who are refractory to covalent BTK inhibitors in CLL, in mantle cell lymphoma, it's not clear where Pirtobrutinib as a non-covalent BTK inhibitor should fit, and potentially could move into the second line ahead of other covalent BTK inhibitors. And then I'll just say one thing about a frontline study that I'm really excited about, which is the BOVen study of Zanubrutinib, Obinutuzumab, and Venetoclax, specifically in the TP53-mutated population. Because as I said, this is a group of patients who have had very poor prognosis, and I think a non-chemotherapy approach like this in the frontline setting has the potential to really change the standard of care for these patients.